Welcome to our series of healthcare scene interviews where we sit down with top leaders in healthcare IT. I'm John Lynn, the founder of healthcarescene.com, a network of leading health IT resources. We have two special guests today. We have Terry Edwards, President and CEO of Perfectserve, and Ben Moore, CEO and founder of Telmediq. Welcome, guys. Glad to have you here.
Nice to see you, John. Happy New Year.
Yeah, I'm excited. So, we've come together. There was big news just coming out today that Perfectserve has announced the acquisition of Telmediq and kind of the joining of these two companies. So tell us, what brought you guys together?
Yeah, as we spoke before, John, Telmediq was founded out of a very specific need based on a personal experience with myself in a healthcare environment with the birth of my daughter, witnessing a breakdown of communications. And, that all started 8 years ago. So when we brought Telmediq to market and started getting out into the market, we quickly learned about Perfectserve. And over many interactions and competitions with Perfectserve, actually developed a deep admiration for Perfectserve's approach. And what's specifically unique about Perfectserve in this space was coming at things, fixing problems for physicians and workflow and other clinicians. So taking a very deep approach to solving these communication problems. And in that way, our cultures all along the road here have been very similar. And I got to know Terry just, through both competing with him and being at the same sort of events as Terry. And we kind of found that we were kindred spirits. And we started sitting down and talking about what the future of this space looked like and found that we were very much aligned. And from my perspective, what this really means is we've come together to create the dominant player in the category.
Nice. So, I wouldn't be an appropriate journalist, although I consider myself a blogger more than journalist. But, are you sharing the terms of the deal? Or what are the terms of the deal that you've created? Terry, maybe you want to take that one?
Sure, John, and thank you. We're both delighted to be here. But in terms of the, sharing the terms of the deal, we can't really go into the specifics of that right now. But we're putting the two organizations together, and Ben is going to join us, join the Perfectserve senior management team as Chief Product Officer, and we're just delighted to have him on board, and I'm really looking forward to working with him as we move the company forward.
Yeah, it sounds good. I assumed there would be a deflection there, as most of them do, right? It's kind of a feature these days. But so, what is your vision for these combined companies? What do you see each company bringing to the table?
So, this is really the first step in a broader strategy. And the broader strategy is really about building the care team collaboration platform of the future. And within that broader strategy, clinical communication is really a cornerstone. And I believe that between both Perfectserve and Telmediq, we've got the most comprehensive set of capabilities combined. And so we'll be working to combine the strengths of each of the platforms. We're fully supporting both platforms going forward, but we'll be integrating them in such a way that we can bring the capabilities that Telmediq has, for example, to the Perfectserve customer base, as well as Perfectserve capabilities to the Telmediq customer base. But longer term, it's really about evolving both platforms to bring together a more comprehensive care team collaboration solution, of which communication will be a component, but there'll be other capabilities as well.
Nice. Well, I think it's an interesting vision. I think a couple of years ago, Ben and I talked about why don't we bring them all together so we could have communication across them all. So
that's
interesting mix of that vision. But what are the things that you'll be able to do together that maybe you couldn't have done separately?
Yeah, we're already seeing across our existing customer base, deployed base, those synergies come into effect. That's what we've been doing for the last couple of months. Just some examples would include some of the more advanced dynamic intelligent routing that's really a core of the Perfectserve platform. But also some things that you're going to start seeing come out around patient and family communication which has been a key and missing part of these communication platforms today. Well, we're now rolling that out, as well as more advanced physician scheduling capabilities. And we can't spill all the beans today, obviously, from a product perspective, but you're gonna see some very interesting announcements in the near future in that regard, and a lot of other coming news and capabilities. There's also, of course, the call center. You know, right at the center of the hospital, at least the nerve center of the hospital, is the contact and call center. And Telmediq and Perfectserve now offers a combined platform, the only solution that brings that to market in a single platform. So that's all very exciting. So ultimately, with the product vision, we now have scope that works not just inside the walls of the hospital and also the ambulatory clinics, but pushing right out to the edge of healthcare and addressing the need to have patients as part of the messaging here and the story.
Nice. So I think that's interesting. And yeah, we talked previously even about some of the devices you're pushing out. Is that still a goal of the combined companies, is doing the devices as well? You know, I know that's a big topic for a lot of hospital and healthcare organizations.
Absolutely. We've, over the last couple of years, our organizations have made huge strides in, you know, what you might refer to as nurse mobility. Shared devices inside the walls of the hospital for instant access to communication and patient information right at the point of care. That's a reality now. That's a lot of what we're doing today with our healthcare system partners, is deploying those solutions.
Nice. And so, you know, just to kind of wrap up, what's the roadmap of combining the companies? Is Ben sticking around? Is his team sticking around?
Oh yeah.
You know, and you know, yeah, you already mentioned kind of you're not planning to sunset any product lines, at least initially. So, what's the roadmap forward, Terry?
So the first phase, we're working through a pretty thoughtful exercise to determine how to combine the platforms together. Fortunately, we both are built in the cloud using a service-oriented architecture, and so all the various capabilities of both platforms are componentized, and just even within each platform separately, the different services talk to each other through APIs. And so we're working out the approach to allow the services to talk cross-platform. And so that's near term. And then, as Ben alluded to earlier, there's capabilities that we'll be rolling out. Some of those capabilities are here right now, but to bring in the patient and family member as part of the care team, as well as to bring new adjacent technologies and services to the platform as well, such as physician scheduling. And it'll be a mix of both merger and acquisition as well as organic development.
Awesome. Well, you know, I think, you know, Perfectserve was acquired by private equity, and you know, this is a normal strategy for private equity.
Yeah.
So maybe this is the start of many more acquisitions, and we'll have some more conversations in the future. But you know, thanks so much for sharing the insights of this new acquisition, and you know, I'm sure your customers will be interested to hear, you know, what's the plan going forward, and we'll certainly be watching and, you know, talking to you more. For those watching at home, we've been here with Terry Edwards, President and CEO of Perfectserve, and Ben Moore, CEO and founder of Telmediq. If you want to find more great health IT content like this, check it out at healthcareittoday.com. Thanks, guys.
Thanks, John.
Thank you very much, John.